Hello everyone, I'm John DeShula. Welcome to Innovations in Health. I'm joined by Dr. Lori DeLucia from Burnt Hills Dentistry. We're talking about the mini dental implant and how it can change your life. Welcome to Innovations in Health.
Well, thank you. I'm glad to be here.
And you have some models in front of you.
Yes.
And let's start with one of them because as we know with dentures, you get that uneasy feeling. You know, the denture kind of hangs right there on the gum and you need that goop to keep it together. But a mini dental implant, you get that titanium post and it holds the denture in place, or some other teeth examples. Let's take a look at a denture and explain to us what you've got.
Okay, right here I have an upper denture that you can see. You can see I'm having a hard time pulling it off, which is wonderful because it's held in with the mini implants. And one of the really nice advantages of this is that most of the time this whole area is filled in with the acrylic. But because it snaps right into the mini implants, we can actually take this away. Feels much more natural, much more secure, and people can taste their food much better.
That's very important because people with dentures, you know, and I know my mom had dentures, and sometimes people just feel like that's the way it's got to be, but it doesn't have to be that way.
No, it doesn't.
And there are dentures up top and there are dentures below. Show us another example.
Sure, and here is a lower denture. Same thing, many times the lower dentures really have a hard time staying in because the tongue wants to pop them out. In this case, you can see we have the 4 in this example. It can snap right into place and give a sense of security that a lot of people haven't had in a very long time.
And where you are, Dr. Lori, at the Burnt Hills Dentistry, the Mini Dental Implant Centers of America, very important because it's you're the expert in the Capital District. You know, here in Albany, Schenectady, Troy, Saratoga Springs, you are the go-to person. And with the dentures, if somebody has an existing denture, you can add the implant to it, or you can create a new denture just for them.
Exactly, yes. In general, we prefer to make a new one simply because we can control the quality of it. We know exactly how it's going to fit in. But yes, many times we can work with the denture that they already have, and it'll feel like a whole new set of dentures because now they stay in place without all that goop you talked about.
With the goop, and that, you know, the goop goes, oh, you swallow it, it's just terrible. And you know, you can enjoy all the favorite foods. I mean, what isn't there to like here in New York State? You have all the great fresh vegetables and fruits and steak. You can dig right in. And, you know, the embarrassment, if they fall out, or there's that sense of self-confidence that's gone because you're wondering, you know, what's going to happen, or the embarrassment. Now, you have some other examples, too, because the mini dental implant is not just for dentures, but it really adds a full set of teeth to the individual.
Yes, exactly. We have right here the Fix on 6, which only the dentist will take it out at checkup appointments for cleanings, but it is securely in there, snaps right into place. And both this and this other set, which is cemented permanently, are basically a third set of teeth. God gave us 2 sets. We can make a third.
You can.
Yes.
You can make such a big difference. And the care for the mini dental implant, if somebody has it as a denture or with the Fix on 6 or that third set, how would you care for the mini dental implant?
Using a water pick to get up and around, keep them clean, and brushing, absolutely. Yes.
And visits to the dentist.
And visits to the dentist, of course.
And we should mention that, you know, the mini dental implant is really 5 times less invasive, less discomfort, less healing time, less visits to the dentist, and less cost.
Yes.
That 5 times less is so important.
It's huge. It's huge.
And if you are looking for just a few teeth, you know, maybe it's teeth in the back, and you're saying, well, those teeth, no one sees them. But it's very important because those teeth, you have to conform and make sure your mouth and the teeth in there don't move.
Absolutely, absolutely. You want to maintain the relationship of the teeth. Here's an example of it right here. You can see how natural. It maintains the relationship of all the teeth. Not to mention, on top of that, it helps with chewing. You have better power in that way, and you're also protecting all your front teeth. A lot of people think, oh, it's in the back, it's not that important. But you know what? You lose teeth in the back, all your front teeth take a lot more force, and then they start to break down.
So you have to be able to chew your food to enjoy all of what God has given us, and that's why those back teeth are as important as the front teeth.
Yes, absolutely.
And speaking of front teeth or single tooth, if you have a sports injury or a tooth has a decay or you have a problem, show us an example of how a mini dental implant will work with just 1 tooth.
Right here. And many people growing up, either from sports injuries, you know, falling off of a bike, something like that, they'll lose a front tooth, and we can replace it very quickly and easily using mini dental implants.
And it snaps right into place firmly and securely, and you can take care of it just like you would a normal set of teeth. Talk to us about the broad smile, because that sense of confidence that a mini dental implant brings to an individual is so important.
Yes, I've had many patients come to me and maybe they have 1 or 2 teeth missing in the back, and they're very concerned about when they have pictures taken, you know, say at a wedding, they only want to turn to one side, they want to put their hand up when they're talking to other people to hide that space. And once that's restored, they can smile and interact with confidence again.
I had a missing tooth in the back of my mouth from when I was a teenager. And after a while, I started to have a lot of jaw pain because I would only chew on the opposite side. When I finally decided to fix the problem, unfortunately, the space had closed so much that there wasn't room for a traditional implant. And I had 4 orthodontists and dentists tell me that I needed braces and possibly even another tooth pulled in order to make the space that was needed, which would obviously have been a huge time commitment, not to mention cost. Then I met Dr. DeLucia, and she suggested a mini implant. It took 1 visit to prepare the surrounding teeth and 1 visit to place the implant. And I was thrilled. I had no downtime, I had no pain, I could immediately chew on both sides of my mouth. And I had that problem for so long, I couldn't believe how easy it was for Dr. DeLucia to fix it.
So imagine having that sense of confidence, imagine having that smile. Dr. Lori DeLucia, Burnt Hills Dentistry, a mini dental implant center of America, 105 Lake Hill Road, Suite 6, Burnt Hills, New York. And the phone number, by the way, is 518-399-4290, and your website, BurntHillsMiniDentalImplants.com. I'll say it again, BurntHillsMiniDentalImplants.com. And you're serving everyone here in the Capital District. So whether you're in Albany, Schenectady, Troy, you know, Saratoga Springs, all of the great areas here in the Capital District, you're the go-to person.
Yes.
Talk to us too about the consultation, because you offer a free consultation for patients that come in.
Well, first we want to determine what their concerns are. We talk to them. We also offer some imaging to help determine, you know, the level of bone and what we can do for them.
Well, and that's very exclusive. That 3D imaging, you're able to now take a look inside the patient and really dissect and affirm just what needs to be done and where.
Right, exactly.
And one of the things that we had talked about, you know, there were the old implants that some people are used to, and then you have the mini dental implant, which is such a great advancement. The old implants, you have to have bone grafting. It took a long time for that bone to build inside the gum. The implant itself was a much larger hole that had to be made. The mini dental implant is a smaller titanium post. But you have a story of a patient who actually lived both sides of the implant experience. Explain that.
Yes, yes. She had her lower left side. She'd lost a lot of teeth there, and she, several years ago, had traditional implants. And then not that long ago, she had more teeth that were lost on the lower right side. And immediately she said to me, I don't want to go and have to go through all that again. It took about 1.5 years for me to finally get teeth. And so I said, no, I mean, we can do the mini implants and get you back functioning very quickly. And the nice thing is she was very concerned because she was going away on vacation in a month, and we were able to have her with her full smile back again, chewing and enjoying all the food on vacation.
And that's an important point, because this is a procedure that's done right in your office.
Yes, yes.
I've had the traditional implants on one side and the mini implants on the other side. And the traditional implants were much more involved, closer to a small surgery. The mini implants were just a dental procedure and healed a lot faster.
So there's no outpatient, and you know, the pain issue here, you know, a lot of people will say, well, going to the dentist is painful. They have these stereotypes, which is probably why some people don't even go in to get their teeth cleaned.
Yes.
Let alone a procedure like this. But the pain is, you're really talking about maybe an over-the-counter medication after this procedure's done.
Yes, and I always recommend just to take a little bit of ibuprofen or Tylenol just in case. Many patients, you know, I've had some patients who don't take it and they tell me they never needed it.
Yeah.
I called one woman after she had a mini dental implant placed, and I asked her how she was doing. She said, I am fabulous. And she kind of whispered, but don't tell my husband. He's taking care of the kids. I'm lying on the couch. He can't know how easy this was.
So she was extending that level of sympathy, which really wasn't even necessary. So the mini dental implant, Dr. Laurie DeLucia is here. Remember, the mini dental implant, 5 times less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive than the older implant procedure.
Absolutely.
Talk to me how you work with a patient when it comes to the cost.
Well, we have several forms of financing available.
And it's important because, you know, doctor, as someone comes in for the consultation, I'm sure they'll talk to you about the cost, and it might be a reason why someone that might be out there now watching saying, well, this is something I don't want to do, or maybe it seems like an investment in themselves that they maybe have put off for a long time. But you're working with the patient, you're working with that individual, you're offering these options that can extend some monthly payments so that it's not so much really when you look at it.
No, not at all. It's very doable for a lot of people.
And the sense of self-confidence, whether you're in a relationship, whether you're talking about a new job, you know, it just dealing with your everyday life. Talk to us about some of the patient stories where those people enjoyed the sense of self-confidence again.
One of the biggest things that I hear people say is that they wish they had done it sooner. As soon as it's over, done with, they have their teeth, their full smile, they can't believe how easy it was and how much it has affected them in every way. That they smile more without thinking about it. They just naturally smile more. They interact with more confidence. You know, say it is a new job they would like to apply for. They then feel confident going out and doing it.
That's so important because that sense of confidence is what really brings your quality of life up. So it's an investment in your quality of life and how you interact with your family and all of the good things that come with it. Not to mention the fact that, as I said, you can enjoy that ear of corn, that steak, that apple if you're a vegetarian, you know, all those vegetables that crunch. Not an issue.
Yep, exactly.
I wanted my smile back like I had when I was a younger person. I had my procedure a few months ago and it went great. No problem, I love them. I truly thought that it would be very, very painful. And I was amazed that it only took a little over an hour, and when I went home, I could basically eat everything again. Everyone notices, you know, that I smile more, and my confidence is better now than it ever has been. And they're amazed how, you know, how it changed my whole life.
So if you're out there watching, ladies and gentlemen, and you're saying, I have a denture, and you know, as we talked about, that denture's floating around on the gum and you're putting all that goop on it, out. That procedure is out. The mini dental implant, it's a titanium post, and the tooth adheres to the titanium post, whether it's your denture or whether it's the examples that you just showed. And this is an FDA approved Made in America product because the titanium post is there, but the teeth themselves are made of a substance that can take all that life can give it. Let's talk about you, Dr. Laurie DeLucia. How long have you been practicing dentistry here in the Capital District?
Well, in the Capital District, I've been here 7 years. I graduated in 2003 and stayed on Long Island for advanced training. And then I went to Syracuse, where I practiced for 5 years, and then moved back.
Yeah, and you were at Stony Brook for a while.
Yes.
Yeah.
Yes.
And through all of this education, the mini dental implant procedure was not happening at that point in 2003, but you do general dentistry as well, and you have a whole team in place in your office at Burnt Hills. So as you became involved in dentistry and your passion for helping patients, what motivated you and where did you find out about the mini dental implant options?
I went for a lot of advanced training to place conventional implants but I found that there was a group of patients that they just really did not work for. They needed to have so many advanced procedures, which would add so much time and so much surgery to be able to finally get the implants, that I started looking into other options. And the mini dental implants were mentioned to me by a colleague who practices in New York City. And once I looked into it, and I couldn't believe it. And the more I did them, the more I believed in them. And even though I still do place occasionally traditional implants, mini dental implants are preferred 100%.
Yeah, and you've gone and found, you know, the top individual in you know, all of the United States.
For sure.
Who, Dr. Todd Chatkin, who was able to give you the kind of training and continues to give you the training keep your practice on the cutting edge.
Yes.
Because it's cutting edge, it's brand new, and sometimes people say, well, it seems like it's too good to be true, but it really isn't the case.
It isn't, no. And I always liken it to traditional surgery, where you have to basically have incisions be opened up, versus laparoscopic surgery, which is a trend now, which is so much less invasive, so much easier on the patient, and the results are just as good, if not better.
Tell us why some people may have an aversion to going to the dentist, whether it's for a mini dental implant or a basic cleaning, that we should dispel those stereotypes.
One of the biggest concerns is fear for a lot of patients, and that's something that I really take to heart, and I really feel for people, and I always tell my patients, if you're comfortable, I'm comfortable. If you're not comfortable, I'm uncomfortable. So patient comfort is huge to me. I think cost sometimes can be a concern as well.
Sure.
And as we mentioned, we do have several financing options available, but in terms of cost, mini dental implants are a perfect solution, which I think make implant dentistry a lot more feasible for people who might not be able to have it otherwise.
And your dental health really applies to so many other areas of the body.
Absolutely,
you can find out a lot
yes.
about the human condition based on how someone's teeth are or how they're not.
Absolutely.
And the nerve endings and all of that. So a visit to the dentist is important on many levels, not only for the
yes.
mini dental implant, but for your overall health in general.
Yes, absolutely. Many conditions affect the teeth and vice versa.
That's, we'll go back to you a little bit. I think Dr. Lori DeLucia, who we're talking to here on Innovations in Health, Burnt Hills Dentistry and Mini Dental Implant Centers of America, 105 Lake Hill Road, Suite 6, Burnt Hills, New York. The phone number 518-399-4290, 518-399-4290. Call. If you're seeing another dentist, that's okay. Dr. Lori and her team will meet with you. You'll get a free consultation. You'll find out about the mini dental implant. And the Burnt Hills Mini Dental Implants.com is the website, BurntHillsMiniDentalImplants.com, where you can find out more as well. But back to you, you're a pet lover.
Yes.
I know a lot of our viewers of Innovations in Health are pet lovers as well.
Yes. We, over the years, we've done a lot of rescue work, and we recently lost one of our very special dogs, and so we're excited to say that in a couple of weeks, we're going to be getting two siblings who are rescue puppies. We're very excited to be getting them.
There you go.
Yeah.
So do you bring the dogs to the office sometimes, the pets?
Not too much, but sometimes after hours they can be seen visiting and spreading their doggy cheer.
Cheer, that's right.
Yes.
Spreading the smile, whether it's the
Yes.
pets that are spreading the smile or the mini dental implant.
Yes.
For viewers that are just joining us, we're talking about the mini dental implant procedure here on Innovations in Health. And let's go through the examples just for a little bit, and then we'll continue the discussion. But if somebody has that denture, and they've been watching, and they saw that example earlier on in the program, show them one more time what the mini dental implant will do.
Okay, well right here we have the upper denture, which you can see I worked a little bit to get this off. Many times we're able to just trim the denture down, make it a lot more comfortable for patients, relieve that gag reflex. They can eat and taste their food much more easily. Same thing with the lower, secure it in place, which I found it's almost a universal agreement that most patients do not care for lower dentures when they're not stabilized, because they move around, the tongue moves them around, and they always seem to just move around, float.
And what would be the reason that an individual would be prescribed and given a denture, which would mean taking out all of their teeth?
Some people have lost bone structure around the teeth and they're very loose, and one concern with that is that not only having the periodontal disease, which is what it is, or gum disease, is it also can affect the heart. And people with diabetes are more prone to it. So taking the teeth out, not only does it clean up the health in the mouth, but also the entire body. And many times they find once they replace the teeth, especially if it's either with mini implant supported dentures or something that's more permanent, like these fixed options, they feel a lot better because their body's been fighting infection in the mouth, but they're also much more proud of their smile because they were always afraid to bite into things because maybe a tooth might come out,
Sure.
or that's what they were concerned might happen.
So there is a bit of a stigma maybe that with a denture, but if it's needed and it's necessary and it helps them,
Yes.
then you have to move forward with that.
Yes, absolutely. And I've never had a patient regret doing it.
Yeah.
Yeah.
And let's talk about the age of a patient for the mini dental implant. You know, sometimes we associate dentures with someone who may be more of an older age. Not always necessarily
Not
the
always,
case. It could be
no.
somebody who, like you said, had some periodontal issues.
Yes, or just was very prone to cavities, or had certain dental conditions that their teeth just wore down over time, or accidents, so teeth broke. It can really be for all age ranges.
So if somebody might be having a dental issue currently
Yes.
that would lead to the need for a denture, you would be able to figure that out too with the patient.
Yes, oh, absolutely.
Yeah.
Yes.
This really elevates this to the next level. So you go
Yes.
from that denture to something that is as God-given almost in appearance as the teeth that would be perfect.
Yes, and they're very small. I mean, it's basically like another set of teeth. Exactly.
And it snaps right
And
into
they're
place.
secured, yes.
The titanium post that goes into the gum, unlike the conventional implant, you don't need that much bone for it.
No,
To adhere.
it's just a little pinhole that's removed. And if they've lost a lot of bone, you don't need a lot to place the mini implants.
Yeah. And so the Fix on 6 you just showed us, let's take a look at this next example again, because this I think is really the ultimate, if you will.
Yes, this is. As you can see, there's many more mini implants here, and this is cemented right in place. And once it's cemented, it never comes out.
And
right in
as
there.
a dentist, you would be the one to adhere this in the office
Yes,
and apply the cement, if you will.
yes, yep.
And then the person moves on and continues to maintain those teeth as they would
Yes.
well, they are their own teeth.
Yes,
but
as
if they were natural teeth.
Exactly, yep, exactly. Third set of teeth.
Yeah, the third set of teeth. And again, the side issues. You know, we talked about eating foods, and you know, the confidence level. I can't believe there are some people who go through life not enjoying some of the great foods. You know, particularly here in New York State, that are offered to everybody.
Oh,
you know,
absolutely,
the great
yes.
food, but those back teeth. Why would somebody want to ignore problems with their back teeth?
I think sometimes people think because they're in the back that they're not as important, but they're really important because that's where the majority of your chewing is done. So when you lose teeth or you have spaces, all the other teeth have to take on a lot more work, and over time they start to break down. And so by restoring it, you eat better, you function better, you smile better, and you also protect the teeth that you do have.
And we should mention too, Dr. Laurie, that when these mini dental implants are created, the tooth is molded to the individual.
Yes,
This is not
yes.
something where it comes out of a box and it has to fit and you make it. This
It's
is
customized.
a custom designed tooth for the individual patient.
Yes, and they feel very natural and they look very natural.
And in addition to that, they're made in America. So you know,
Yes.
this is a product that's made right here in the United States. It's designed just for you, exclusively just for you as the patient. And the single tooth option.
Yes.
And this speaks again to the age of an individual who would need an implant, a mini dental implant. Perhaps they have a sports injury. Perhaps a tooth was knocked out, you know, in some natural way, maybe. This is something that will fix that.
Oh, yes, and that's unfortunately a fairly common thing that does happen. For one reason or another, the front tooth gets injured, it's had work done, you know, years ago and breaks and needs to be replaced. I've had patients who don't have any fillings in their mouth, no other dental work that needs to be done, but a front tooth needs to be replaced because of an accident or something like that.
And it could be with a younger person as well.
Yes, absolutely.
Yeah, so here if somebody's in the Capital District and they're enjoying life and that they need that tooth, or they need to maybe take a look at a tooth that's giving them problems. What would make a tooth decay? What would make a problem tooth need to be removed?
A crack in the front, if it's a tooth that's been root canaled for whatever reason, say it had large cavities or it was traumatized by a fall or a break, and it sometimes braces over time, the roots can start to resorb and loosen. There's multiple reasons that can cause it. But one of the things that's really nice about this procedure is that many times we can just take the tooth out, put the mini implant in, and the patient leaves with the tooth. They don't have to worry about having a flipper or having a denture for months and months to a year while they wait for it to heal.
That's a very important point because
Yes.
the older implant procedure, it takes a long time.
Yes, yes.
What is the length of time that it would take for an individual to get the mini dental implant procedure in your office?
If they needed to have the tooth extracted, we would have them come in, we would extract the tooth right at that appointment. We would place the mini implant. We could do the grafting procedure right then and there. When they leave, they would, depending on the situation, they'd either have a permanent crown or, more likely, a temporary crown that looks very natural. So they can go about their day, not worry about smiling, not worry about a flipper.
Right.
And then they would return once the tissue has healed, so that we know we can get a very natural looking impression, make a very natural looking tooth, lead impression, and get them into it, into the permanent.
What is a flipper? What would that be?
A
Would it be
flipper
like a retainer kind
is,
of device?
it's like a little one tooth mini denture that just pops in and out, and that's exactly what it does. It flips, so that it flips back and forth,
Yeah.
and it honestly really annoys a lot of patients. I've never met one that likes it.
Well, sure. Nobody wants
Yes.
that sense of, not being comfortable. And the age range for a patient for a single tooth or some of the back teeth, it could be someone who is, a teenager or even younger,
Yeah.
who's dealing with that. And if a parent or a grandparent is watching, this might be an option for someone in your
Yes.
family.
Exactly.
So
Yeah.
they can't think of the mini dental implant as just a procedure for someone who is older.
Exactly. Yeah. It really can work for all age ranges.
When you were going to dental school, did you ever think that the technology would advance? We've talked about the 3D imaging that you do at your facility, and we talked now about the mini dental implant procedure. Did you ever think that dentistry would advance to where it's at right now?
Like I said, I started looking into the mini dental implants for patients who some of the other options just did not work for. And honestly, I was blown away by it.
Yeah.
I mean, people are so happy and they do so well.
And we're going to give you the address here for if you're watching Innovations in Health and you're saying, I want to meet Dr. Laurie DeLucia. You can at Burnt Hills Dentistry, the Mini Dental Implant Centers of America, 105 Lake Hill Road, Suite 6, Burnt Hills, New York. And the phone number there, 518-399-4290. You've been seeing it throughout our program here. So write it down. Make sure you get a pen and paper, 518-399-4290. And if you're online, BurntHillsMiniDentalImplants.com. And what would we find on your website?
There's some tutorials, little
Explanations of some of the things you do.
explanations, yes.
Yeah, get to meet you.
Exactly,
Yeah.
yes.
Find out more about the mini dental implant procedure and certainly where we can find out more about you. Well, Innovations in Health, the mini dental implant procedure, we hope that we have convinced you that at least a free consultation should be in
Yes,
your future.
absolutely,
Absolutely.
yes.
And anywhere in the Capital District. So if you're watching in Albany, if you're watching in Schenectady, Troy, New York, I used to have friends lived in Troy, New York. It's a great
okay.
place.
Yes, it
we love
is.
Troy
Yes, it
here.
is.
You really need to go and see you and welcome those patients to you to find out
Yes.
about the mini dental implant procedure. Again, ladies and gentlemen, it is 5 times less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive. Dr. Laurie DeLucia, your patients are happy, I'm sure, when they leave you.
Yes, they love it.
Yeah.
They love it.
And we're happy that you spent some time with us here on
and
Innovations in Health.
I'm very happy to have done so as well.
Thank you very much.
Yeah,
All right,
thank
the
you.
mini dental implant, it will change your life.